Good afternoon, everyone. It's Liz Agnew from MedTech here. Thank you for joining me on your lunch breaks. I hope you're keeping warm. I'm in Christchurch and I've got very freezing fingers, so I'll have to warm them up before I start typing on my keyboard. So as you're well aware, it was due for end of November, but at the weekend, Te Whatu Ora decommissioned the CIR, COVID Immunisation Register, and the NIR, the National Immunisation Register, and migrated to AIR, the Aotearoa Immunisation Register. So what does this mean for you as vaccinators? So you'll be pleased to know that it's not going to be a change to your workflow or your processes. The way you record immunisations at the moment is going to stay the same. So at the moment, you'll be, these are the changes that are being made to our PMSs, Evolution and MedTech 32. Te Whatu Ora want you to send all vaccinations to air. You are going to have the ability to record locally administered COVID-19 vaccinations instead of using CIR, as well as recording overseas administered COVID-19 vaccinations. You'll be able to also record standard travel vaccines and privately funded vaccines, as well as there's an update to the meningococcal B and HPV dosing schedules. And then last of all, we'll be able to show you how you can send historic scheduled vaccines that you've not previously sent to NIR to air. Okay, so first off, sending all vaccinations to air. So Te Whatu Ora have advised that it's now mandatory to send all vaccinations to air. And so to do that, we need to get all the patients' NIR statuses to opt on. Your NIR statuses are located in two places, patient register and immunisation schedule selection. So if we have a look at Evolution first, under your patient register, you've got a consent tab where your NIR status is, as well as in the immunisation status screen, your schedule selection tab has got the NIR status drop down. Okay, for MedTech 32, your patient register NIR status is on the More tab, and for your immunisation screen, it is there. Be aware that if you have not selected it and you go to give an immunisation, you should also get this reminder to say you need to choose opt on, and then that will set that and allow the vaccination to send. Please be aware that you need to stop using your codes that you've added in yourself. We'll be providing a batch of new codes to use. Also, please feel free to use the Q&A section if you have any questions, and I will go through those at the end. I think that we'll probably run through this pretty quickly, so it won't probably take the whole hour. Okay, so for administering COVID-19 vaccination events, we've got 5 different vaccines that you are able to administer in New Zealand. So these are the codes. Be aware all this information is in the release notes. And those are the codes that we'll message to air. Be aware that you need to administer these. Here's a bit more information. You need to administer them and add them into the PMS as soon as possible, because the payment system is going to be different for COVID vaccinations. the payment will get processed on the receipt of the message. So there's no invoice or claim that will get generated into the PMS. So you need to make sure that message gets entered at the correct time. There's a different rate for after hours vaccinations there are for during the day. And we'll shortly bring out a couple of query builder reports that you could import that will be able to give you a list of the COVID vaccines that you've provided so that you can match it up with your payment report that you'll get from Te Whatu Ora. Okay, I'll just pop into the PMS and you'll be able to see. So step 1 for adding a COVID vaccine, opt on, go to your all immunisations tab, add a new term, and then find the code that you need. Make sure you got provider, vaccinator, route, site, batch number and expiry as per normal. Fill all those out and then hit OK. Same for MedTech 32. Step 1 was always opt on, go to all IMS and add a new one from your drop-down list. Be aware there are some old ones in here. Ignore those. Originally, Te Whatu Ora asked for all the overseas ones to be put in. So there's a lot there. So these are the, that's one of the New Zealand ones there. So again, put in your correct provider, vaccinator, and other details about the vaccine. Okay. So that's your New Zealand vaccination events for COVID. For overseas administered COVID-19 vaccines, if you've got a patient that's coming in from overseas and you want to record what they've had, you now have just the one set of vaccination codes to use. So ignore all those other ones and just go with this set. Te Whatu Ora would like the country and evidence recorded. So that doesn't need to get sent with the vaccination message, but they are saying that it should be held in your PMS. So if you've got a picture of their COVID vaccination record or something like that, that would suffice. Okay, so giving an overseas COVID vaccine, same as what you do for a single vaccine. Again, make sure you opted on, come to your all IMS and find the code on the list. So that would be the challenge, is finding them. Ignore the ones that say the US unspecified ones. They are not used anymore. So it's these OS slightly truncated for MedTech 32. Evolution's got a bit more space that you can. Okay. It defaults to saying the outcome is given overseas, and then you record, and that's all you need for that. Okay, moving on to privately funded vaccinations. So generally your travel vaccinations, but if any patients want to purchase any additional vaccinations, we've prefixed everything with a P- for privately funded or P for paid for. So these are the codes that need to be used to be able to send that information to AIR. I think you get the idea of going through and adding them, same as any of the COVIDs or single vaccinations that you've previously done, just that single vaccination from the all immunisations tab. Okay, next up, meningococcal B schedule updates. So Te Whare have updated the dose schedule so that it lines up with the handbook. And so if you've got anyone at the moment that has had their first or second doses and require a third one, then the recall dates will be updated so that they are the correct dose schedule. And if there's an item that is not required, like for this one, the dose 3, then we'll remove that and remove the recall for it and put it as closed, not required. That's for your schedule that's for the 8-week, 16-week, 12-month groups. And then for the young adults also, they've got an update for dose 2 being 2 months after dose 1. And again, if anyone's got any outstanding recall for that dose, that will be updated. I had a meeting with some immunisation coordinators a couple of weeks ago, and they provided me this picture just to reiterate that it's really important to make sure that the past vaccine history is checked. You could do a status query, same as you do now, and then in the PMS have a check in the all immunisations tab, and also you can select the vaccination schedule that they are on. So for your MenB, opt on, choose your particular schedule, check under all immunisations that they haven't had one, that perhaps it was a code that was added by the practice, so that won't show up on your IM schedule, and then you can go to the IM schedule and give as per normal. Just while I'm in here, the NIR status query button will work as per normal. That will message to EAR to get the information to you and can be updated the same way that you do now. And it's the same for in here. Opt on, select your schedule, check that you haven't got anything already given. You do a status query check from there and then come in here to give. Okay, next up we have a couple of changes to HPV schedules for the 9 to 14-year-old and the 15 to 26-year-olds. And again, we will update any existing recalls that need to be, so that you don't need to worry about that. You'll be just going into your recall contact list as per normal to get your lists. And if anyone's not required, again, we will set that as closed, not required. The other thing that you'll have is the ability to send historic immunisations to EAR, as long as they're ones that were part of a schedule. So perhaps someone's previously opted off and now want those messages sent through. Just make sure that you have got consent to the patient. And Te Whare have said that it must be auditable. So if you gain that consent, then all you'll be needing to do is, so if this was previously off, make sure it's set to on. Any item that was previously given, I'll fix that later. Again, you would just double click on it, put something in a note. Most people put a dot. You could type in resent if you wanted, and okay that, and that will then message through, as long as you have all the information correct. So I would need to correct that and put some information for that to go. Exact same in MedTech 32. If you have something in here that you've been previously given but not sent, make sure opt-on is on. Go to the item that you want to send, double click on it, and enter some text into this note field. Any change that will make it go. Just make sure you got your vaccinator provider details correct. Okay, so as you can see, there's not actually a lot of change there. If I go back to here, so sending all vaccinations to air, make sure you opted on, recording your COVID-19 vaccinations using the 5 new, well, they're not new, but they're 5 codes there that are available. Those are the only 5 to use for New Zealand, and the 1 code for overseas. Oops, sorry. You can record travel vaccines and privately funded vaccines. Just make sure that you do not use your old codes. I'm aware that there are a lot of codes in the system. As you'll be aware, MedTech 32 is in maintenance mode, so it's not getting any code changes made to it. But for evolution, we have a phase 2 coming next year, which we will filter out all the historic records from the vaccination list to make it easier for you to find the ones that are current, and that will assist you in finding the right vaccines in a more timely manner. We've got the update to the MenB and HPV dosing schedules, and then you've got the ability to send your historic scheduled vaccines that you haven't previously sent to NIR, send those now to AIR. Okay, so that was a very quick run through. Just a note on the codes. These are your vaccination codes in the description. Might be slightly shorter for MedTech 32, but you'll see these in your release notes. Highly recommend that you go to our Insight portal, which I've got up on the screen there, log into it, and then you'll have either your MedTech 32 or Evolution sections. And here is where all the information is about the update. Here's what's in it, and get these release notes downloaded so that you can share them with the team. What they look like is this, and we've got all the pictures showing you what buttons to push, and also take note of the bits in orange that tell you the important bits of information to note. Now, as you're aware, as I said, the COVID-19 vaccinations are not going to be generating a claim. They're going to go through to AIR, and from there, the payments will be generated. I know that's quite different from how you use it at the moment with your immunisation schedules, so we'll put out a query builder that will be available for importing that will have the ability to do a report on those. I can quickly show you in here. So under your query store, I've got my COVID queries. So because we've got so many COVID codes, I've split the query into 2 parts. So basically, I'm going to be asking for anyone who has opted on, who has had an immunisation since the 4th of December of COVID and that it was given, and then we'll provide all the information, so that will then be able to be matched up with your payment to make sure that you're getting everything you need. Something you could also do is just check that you haven't got someone who's opted off, so you could easily open that up and change that to be opted off and make sure that they are updated so that information is sent, otherwise you'll miss out on that payment. And there were a couple of other queries as well, just for when if someone hasn't noticed that patients have been opted off, you can have a look at people who are opted off and has had a vaccine. So these ones here, if you ran that, then you'd be able to pull patients up and update their status to opt on and resend that message so that all the information is going. So that's a little audit for you to ensure that you are getting everything messaged as required. And then you've got your one type of code, one code only for the overseas unspecified product. They're going to lump them all together, so that makes it easier for you not to have to find all the different weird ones like Sputnik and things like that. So that's simplifies it for recording overseas vaccines, and there are your privately funded vaccines. Schedule updates and resending of historic IMS. Okay, let's switch through to questions. So these updates have been released and are on our website for downloading. So if you have an IT company who do that for you, they would likely have got the email as well, and we'll be able to update that. Your PMS, be aware that you don't need to be logged out for the update to be run. However, you'll need to log off and log back in for the changes to be shown. So next question, we only have an opt-on to NIR one location. Yes, no, so it shows in two places. So it's the same field, but you can get to it through your immunisation module, through the schedule selection tab, or through patient register. For evolution, it's in your consent area. For MedTech 32, it's in more. So the fourth tab in and down here. So you see if it's on, it'll be on in both places. I've got a question, sorry. So all the codes that I've mentioned today are all immunisation codes. Someone had a query as to what the codes were. So they are all the immunisation codes that can be found through adding in a vaccination. You can see here, and so these ones here, these Coronavacs, they are all old, not to be used, but these overseas unspecified ones are correct ones. Is there a way to opt everyone onto NIR, or will we have to do everyone individually? You'll need to do everyone individually. How to record number of vials used, which we used to record on CR under more tab. That's a good question. I would put, you've got the note field in evolution. I can check with Te Wharaora what the story is there. We haven't made any changes to the immunisation screens, so most likely people would put that in the note field. The messages that get created in evolution and MedTech 32 are in a format called HL7. They go via HealthLink, which is the messaging system in the middle, and HealthLink convert that into a different format that goes into EAR. So HealthLink is the middle ground, so there's no change there. That's how it works at the moment. For those of you who aren't aware, you'd have a little NIR utility, which has got messages that you transfer in there. So it shows all the messages that have been sent tells you that they've been acknowledged or whether they've failed. And it also tells you anyone who's got incomplete data. But you will also see those in the provider inbox because you get messages just as normal saying that there's bits that are missing, that were incomplete, that need to be adjusted. Question, can the old COVID codes be deleted? No, because you've used the COVID codes previously against patients, it's preferable that those codes are not deleted, so they will still display. For those that are on evolution, I would recommend we will be filtering those messages out. We'll be putting on a flag that says that they're historic, so that you can get to them if you need to, but they'll just be filtered out in the first instance. So that will be a phase 2 feature that will be coming out next year. Due to the tight time frame of getting this information out from when we got it, the changes that we made have been the bare minimum to get going. Yeah, so opt-on is necessary at present. For evolution, we get to phase 2, then we're going to remove that field. I've got a question. If someone is unable to put a vaccinator name under the vaccinator in the vaccination screen, in the More tab, if you haven't got the person in the drop-down list here, then that means that they can't be set up in your staff member setup correctly. They need to be in there and be a provider and have the correct registration numbers against them. So for overseas, how do you select which product number to use for overseas vax? So for overseas vax, for COVID, I assume this is about COVID, there's just that one code, and it's COS 1 to 10. So these are the COVID overseas unspecified. So those are your ones there to pick from. The recording of this webinar I'm going to put onto Insight Portal so that you'll be able to share that with your team. And if you want a copy of the PowerPoint, I could put that there too, but all the information is in the release notes that are also in Insight Portal. Does the provider still need to be a GP when entering all COVID immunisations? The GP part is for the claiming, so you could leave that as a vaccinator. Since you're not putting a claim through the PMS, it would be fine to leave that as nurse if it's the nurse putting them through. So why would MMR be non-funded? Apparently it's a vaccine that can be purchased. So those are the ones that the Te Whatu Ora have given us. If your upgrade isn't done and you are putting in, if your upgrade hasn't been done, you won't be able to be putting in the private vaccines or travel vaccines because you won't have the codes. COVID vaccines that you put in will not send until you are live. So if you have put some in and you haven't had the update yet, you would need to use the resend option. So open up that vaccine, put a note in and send it. Be aware that you would need to make sure that you are using the right codes though. Query, does anything need to change in HealthLink or are the NIR folders still used? No change there. The NIR folders for HealthLink are still used. Are you still able to do a status query? Yes, you still can. So it's at the moment it's called NIR status query. It's exactly the same process. So you'll get your update message, and if I go into my provider inbox, I'll see if I've got any immunisation updates. So you'll get a message like this come back with what they've had, and you can use your update button to update it to your system if it's not one that's done on you. Just one thing to note, I would check in this details screen to make sure that they're not going to add any additional next of kins if they've got one different to yours. I would check that first before updating. For opt-on, do we need to select opt-on for every vaccine entered? No. So just opt-on the once. Once you've selected opt-on, then any other vaccine that you enter after that, as long as it's using the correct code, we'll send to AIR. What if Bexero was given before funding and used our own coding? Will these records disappear? No, they will not disappear, but don't use your codes going forward. Use the correct codes, the new ones. Will weekly payments for COVID vaccinations go directly to practices or via PHOs? Good question. That's something that Te Whāora haven't advised, so that's something that will have to be checked up with your PHOs. Perhaps start with them. If you use an old code, it will not message to AIR. So that is why we need you to use the new codes, and for evolution, we'll hide the old codes away so that they're out of your way and not sort of reduce the error, the likelihood of mistakes. Can you show us the status query again? Is this any different from before? No different whatsoever. So NIR status query, here's the one in evolution. It puts in the patient's detail, and you're just going to hit the NIR search button. For MedTech 32, it's a bit more hidden, or you might have the button. There's your NIR status query. Oh, mine's not working because but it will be exactly the same screen. So what if the patient does not consent to vaccines being recorded on air? That's an issue that you probably need to discuss with Te Whāora. They're saying that everything needs to be sent. Can you put up the travel vaccine list again? Sure. These are privately funded ones. Yeah, I've got people asking, are you saying patients cannot opt off from newly administered IMS, but we need to get written consent to upload past opted off of IMS events? Yes, that's what Te Whāora have said. So yeah, it is contradictory, but that's the information that we've had from them. Heidi, will it still message through to ear if you put left arm instead of left deltoid? Yes, that information will get sent. Okay, a lot of questions about the consent. That's something that will need to be taken up with Te Whāora or your IMS coordinators. That's not a decision that we've made. What happens if you use an old code instead of a new code? Will it be rejected? It won't send at all, that's what will happen. How about overseas childhood vaccines? We haven't been given that as updates. The only ones we've been given are these privately funded ones. Will there be queries available for payment checking? Yes, that's the one that I went through that will show you COVID vaccines that you've given over the time, and you'll be able to check those. As mentioned before, I'll put the COVID immunisations and query builders onto Insight Portal, so you'll be able to upload them. Can we do the update if we haven't upgraded to 6.3? Yes, you can. Okay, this update is not a full version, it's just an update, so it can be run on version 6 plus of Evolution and your current version of MedTech 32. Someone wants to look at the COVID codes for New Zealand COVID codes. Those are these ones here. Again, it's in the release notes. How do we check a patient's immunisation history on air to enable an instant view of their vaccine? So that's your NIR status query. That's how you do that through MedTech 32 and Evolution. A few queries about PCV 10. Still needing alternative given to get PCV 13. I've discussed this with Te Whatu Ora, and as they haven't, they didn't want the schedules changed. So I've asked, after receiving a lot of feedback about it, I've asked if we can get that changed for you. So we'll write up what's required and send that through to them for consideration. So that was at the stage how Te Whatu Ora wanted that schedule updated. There's a few questions that are not PMS related. So if you've got questions about things you previously did that are not within the system, I'd suggest you talk to the people that are IMS coordinators and PHOs regarding items that are not within the PMS. I've got a question here. Still need to use CIR for stock take purposes, i.e. ordering and recording vials. My understanding is that that CIR has been turned off, so you'll need to, and it's not something that was being asked to be put into the PMS, so that would be something you'll need to take up with Te Whatu Ora. Question, the auto bill was ticked in your example. This normally raises a claim. Do we need it ticked or not for COVID vaccine entering? The auto bill, I would leave it ticked. We have not added a subsidy against the code, so an immunisation will not get generated. If you untick the auto bill and you leave it unticked or forget it will stay unticked, and then the next immunisation you give it was something that needed to be claimed, you may miss out on having that reticked. So as a default, I'd leave it ticked. The COVID vaccines won't generate an invoice. A lot of questions about the history. I've already mentioned NIR, status query. How do we get onto Insight Portal? Insight Portal is insight.medtechglobal.com. And if you haven't got a login, email support@medtechglobal.com. There should be someone in your practice that has access to it though, so I'd just check with your practice manager. So they will have it so that they can do the updates. How do I know if our practice is live? So if the update's been run, have a look for your overseas COVID unspecified code, or one of these ones that I've got up on the moment for these privately funded vaccine. So any of those would show that you've had them, had the update run. With these COVID-19 overseas unspecified product would show that you've had your update done. Okay, if you're on MedTech Cloud, we will update this for you. If a nurse forgets to tick auto bill when entering a vaccine event, how are we able to know as no message shown in PMS? So if the auto bill is not ticked, then no invoice will be generated for a vaccine. So I'm assuming this is for a vaccine that is a scheduled event that is paid for, subsidized. There'll be no little dollar sign showing for that appointment. There'll be nothing in the account holder account screen. There'll be no change to newborn nominations coming into the provider inbox. They will still come through to your NIR provider. And at present, the icons won't change to air. The stage, it was just small changes quickly to get those new codes in and get their messaging. Will you get an error if using the wrong code? No, you won't. But if you use the wrong COVID code, you won't get a payment for it. So yeah, just make sure you're using the right ones. Why are we receiving IMS that we've been given into our provider inbox, IMS updates? You shouldn't be. Oh, if you're sending a message to Air to get a status query, then it will display everything that is on Air. So it will give everything. It will show everything that you've given as well. But when you go to update them, they won't be able to be updated because you've already got them. Error notifications, are they staying the same? Yes, if that's the messages saying that you're missing different mandatory information like next of kin or batch expiry dates, etc., they will all still send messages in the provider inbox. Okay. New Zealand COVID codes being requested to be displayed. So these are those ones there. Okay, when will cloud-based evolution users be updated? So I understand they're being scheduled for this week. The code P-JE1 is not coming up. That must mean that that person doesn't have the update yet. Do all the new codes need to be manually added in evolution? No, they will be in the update. Are vaccines in the schedule selection publicly funded or can be private funded as well? So your schedule selection items, they are your subsidized items, but there is a possibility that somebody could purchase some of those items which are shown on that list of privately funded. Okay, lots of repeats of the same question. Hopefully you've heard the answers and you'll be able, if not, then the webinar will be up on Insight portal. Will there be any change for childhood immunisation codes? No, this update does not touch childhood immunisation codes. Other than the MenB and HPV schedule change, and that's just the time frames of the doses. If we do a status query, will we receive all vaccination history, including COVID vaccines given elsewhere? Yes, you should. You should have everything that is on air regarding that patient. Oh, and thanks, Philippa. A little FYI, you do still need to use CIR for ordering at the moment. So thanks for that. That's sort of outside of the PMS realm. Okay, how do we find information, excuse me, regarding previous vaccinations given, e.g. Shingrix given 2 months ago, documented via NIR mobile caravan, but not updated on our PMS. So that again is your NIR status query. By running that, you should get a message back. Let me just pop in. So your provider inbox, if you've done a status query, you should get a message back, and it should list everything that's been given. And as long as your patient's matched, you should be able to update your system to add those in. So I'll just quickly do this. So the update button should list all of the items. It will show that they're not in MedTech, so you can choose which ones to update. And in this detail, you can also choose to update patient demographic detail. And by hitting that OK button, all of those will then get inserted into the patient's immunisation field. Do all cloud practices get updated at once? Good question. I'm not entirely sure what the schedule is for the cloud upgrades, given that we've just put this out this morning. So okay, a message here, EAR team have advised newborn nominations will come into the practice inbox, not provider inbox. The provider inbox is the inbox. There is only one provider inbox, so yeah. I guess maybe she's talking about the who the provider is for that message. I'm not sure. Sorry, I'm not sure of what you're asking there. Okay, and yes, so a couple of people have just put in that the messages to say that for us, you do need to use CIR to order new COVID vaccines. So thanks for those little messages that have popped in. Okay, so for CIR stock ordering, you'll need to make sure you have at least one person as admin for CIR stock portal to manage stock. Not our realm, but there's a message for the group. Great. Okay. Well, that is the end of my questions. And as I said, I'll put this up on Insight Portal, and then you can refer teammates to it if they want to have a listen. So thank you very much for coming, and if you have any questions, support@medtechglobal.com, and yeah, happy vaccinating. Thanks for your time.